Hi and welcome to Damo Words Podcast. Again, we're talking about everything that's relevant to you. In this episode, we're discussing gynecomastia or man boobs or moobs. So, why does this happen? When does it happen? What's the function that takes you there? And what we can do about them. And in order to talk about that, we must talk about testosterone. We must talk about hormones. So, men undergo hormonal changes as well as women. We hear of premenopause, menopause, but men also have a pause. They have an androgenic pause, a pause in the hormones that lends to growth, muscles, dense bone. When this hormonal change occurs, then men's bodies begin to change. So let's look at some of those changes. First, the trunk gets a lot wider, a lot stoutier. So you find we call it the dad bod. And the dad bod or the dad body comes after that 20s muscular build. So most men who are into having a good physique, who are in the gym, who are eating well, the chest is great, the abs are great, the shoulders are great. And as soon as they hit that 28, 29, 32, we find that the body changes and the trunk becomes wider and rounder. The arms become a lot more narrow and smaller and thinner. The legs become skinnier. So what's happening? Well, we're losing muscle mass and gaining truncal fat or truncal mass. And that's one sign of that androgenic decline or the decline in the testosterone that individual is used to. So this testosterone is important for a few factors. It's important for the density of the bones. It's important for the strength of the muscles. It's important for the fat distribution within the body. And it's also important for the cognitive abilities as well. So testosterone decline can make you feel foggy or forgetful or tired or irritated more easily. And we do know, we just found out about the thinning of the arms and the legs and the widening of the trunk space. So this is what testosterone can do when it's declined within the body. This happens again around the 35-year-ish for men. And the first thing they notice, if they haven't been used to it, you can develop kind of outpouching of the fatty tissue of the chest. So how do we differentiate gynecomastia from just fat? Well, we have the pectoralis muscles, and then there's a layer of fat on top of those muscles. If you are obese, the layer of fat is just full and uniform. If there's gynecomastia along with the obesity, then you get fullness and more breast-looking tissue. If it's just gynecomastia with no fat per se, then it's mostly testosterone decline and the outpouching is just below the nipples itself as it pouches outward and downward. And this is what I'm talking about with gynecomastia, not the full chested breast type tissue from an obese individual, but that small outpouching just below the nipple, sometimes on the side. Sometimes this is so small that we don't realize that it's there, but we find that we don't have a defined chest. So let's look at our 6 images here on screen. Let's look at our before and after models, 3 of them in this next image. And here we see on the first image is an individual, very athletic looking, probably 20s, maybe early 30s, more likely in the 20s, having gynecomastia without the obesity and without the fat surrounding the abdomen and the chest. This is the gynecomastia that I'm talking about. And this is where on the before image, where you can see there's no defined curvature of the lower portion of the pectoralis muscle or the pecs. And so below the nipple has an outpouching that makes it look like small boobs attached to his chest. after the surgery, you can find that the fat pouches are gone and it kind of tucks up into the skin, making a more defined chest pectoralis muscle combination. Or second image is someone who's less athletic but have more fullness within the breast tissue as well. So second image is not just gynecomastia, but it's probably some fatty tissue, dense fatty tissue in that region, and the after results shows how much fat was actually removed in this individual. So his chest became smaller as well. And for him to have a more defined lower chest, then this is where weight training comes in, targeting the lower portion of the pectoralis muscle. The pectoralis muscle have three sections: lower, middle, and upper. And so having a beautiful chest in a man means that all three zones are worked out in the gym. And our last image is someone who is not athletic at all, have some obesity with him, although he's not fat, but the after results show very similar to the above result in that a lot of breast tissue, dense breast tissue, was removed. Men also undergo breast cancer. This is possible. So men can have the same issues as women. When it comes to man boobs, we're talking about testosterone, but we're also talking about estrogen, the female hormone that's also a man. And an increased production of estrogen means that the male can develop more denser breast tissue and therefore theoretically can undergo breast cancer as well. According to the Mayo Clinic, there's approximately 50 to 60% of adolescent males who have gynecomastia, but most of this fatty tissue goes away in adulthood. However, if you're one of the unlucky ones that have gynecomastia from teenage years and you're still in your 20s, or you're now in your 30s or 40s and you still have gynecomastia, a few treatment options still exist. One is losing weight, having a better diet, and exercising. More than likely, the dense fatty tissue would reduce in size until it's pretty much undetectable. If it is still detectable, then you want to look at if there's any underlying medical or health issues pertaining to the growth in breast tissue. We look at your estrogen levels, we look at your testosterone levels. And third is a surgical option where you can actually go in and remove that dense breast tissue. It is not dangerous. However, you would definitely have a much better outlook upon yourself, but you will also feel a lot more comfortable and confident within yourself, especially when you're wearing your shirts. We have celebrities very commonly. And next we have Ice-T. Now Ice-T, yes, he's older. How old is Ice-T now? 50 something? So Ice-T is now up there in his age. He's getting older, but you can see that is a clear testosterone slash estrogen slash hormonal changes that occurs in men. With Ice-T, he has a full trunk, which means his chest, his abdomen, everything is wider and thicker and bigger. It's more like a barrel trunk, and the arms and the legs are a lot smaller. There's nothing good or bad about that. This is just what age does. And sometimes there are underlying medical or health issues that causes this to happen. So we're not breaking or putting down anyone here. What we're doing is talking about natural aging. You can see on Ice-T, yes, we can see some gynecomastia happening there, some dense breast tissue happening as well. But we can also see this in Denzel Washington with the shirt on. Now, I don't have any images on my mind of Denzel Washington with his shirt off. I'm sure a lot of you might have, but I think he does have that dense tissue just below the nipple region. And this is what I mean when you don't have a clear demarcation of that pectoralis muscle meeting the rib cage. And when that sharpness is not there, the only thing that explains that is fatty tissue. Next, we have Jack Nicholson. Again, he's older. Of course, he's not going to look like The Rock. He never did. But you can see that that dense breast tissue as you get older doesn't get better. In actuality, sometimes it gets worse because the androgen, the hormonal androgen levels may be rising, testosterone may be dipping, other health issues may or may not be there, and so that dense breast tissue in healthy men, whether they're young or old, can increase in size. Finally, this Leonardo DiCaprio. Again, we all know Leonardo's chest as he's gotten older. His truncal capacity has gotten wider. His arms and his legs are a little bit on the smaller side. And again, that's normal, healthy aging. If you don't like that, or if your husband, your boyfriend, your brother has this happening to him, you should suggest that he sees his endocrinologist, not the primary care physician, his endocrinologist, and try to find a regimen that works or treatment option that works better for them. That's it for this episode on man boobs, gynecomastia. Don't forget to click that subscribe button for more helpful information on all things beautiful.